好，各位观众，大家好，今天是礼拜四，5月27号，欢迎收看今天现场为大家带来的 Bc 省新冠疫情的新闻简报。那么今天这一次新闻简报呢，是礼拜二省长和另外3位，有一位是就业部部长，另外2位是卫生厅厅长，以及我们的首席医官 Public Health Officer Dr. Bonnie Henry 4个人联合宣布的重启计划。那么按照现在流行的话讲，重启 2.0， 因为去年的这个时候也是重启，那么今年的重启呢，比去年的重启呢更有信心，更有经验，管控起来更有经验，毕竟对病毒的认知1年多下来找到一个平衡他们已经出现了。那么昨天的数字呢是250个新增我们欣喜的看到数字是急剧下降，按照中国话讲叫是断崖式下降这个时髦话。好，我们看看他先自我介绍，然后说到礼拜四的这个5月27号礼拜四的新闻简报。
We're honored to be here on their lands. Tomorrow, Friday, at approximately 3 o'clock,
明天大约3点钟的时候，书面通知。
News relevant to the COVID-19 pandemic in British Columbia, and we'll be back in Victoria on Monday
礼拜一回到维多利亚
briefing at that time.
也是3点钟左右。
It's my honor to introduce
那么现在请 Bonnie Henry 我们的首席医官，好，看看今天的数字啊。
Thank you very much and good afternoon. To start with today, we've had 378 new cases of COVID-19 diagnosed in British Columbia, bringing the total number of people with COVID-19 to 143,264. Of the new cases, 98 were people who lived in the Vancouver Coastal Health Region, 189 are people in the Fraser Health Region, 9 were people who live in the Vancouver Island Health Region, 68 people in Interior Health, and 14 people in Northern Health. We currently have 3,543 active cases across British Columbia, 286 of whom are hospitalized, 88 in critical care or ICU, and 137,929 people are recovered from their acute illness. Sadly, today we've had an additional 7 people who have died from COVID-19 in the province, bringing that total to 1,690 people. Of the 7 who passed away in the last few days, 1 was a person in their 60s, 3 were in their 70s, and 3 were people who are seniors and elders over the age of 80. As always, through this very difficult time, our condolences go to those who have lost loved ones, to their families, to their caregivers, and to their whole communities. We mourn their loss. We have no new outbreaks to report and have now 4 active outbreaks in long-term care assisted living or independent living and 2 in acute care. Earlier this week, the details of our BC Restart Plan were shared with everybody, and I just wanted to provide an update today around faith services. As many people know, we've been having ongoing meetings with faith leaders and have updated the PHO order and a variance that we had been planning to have in place for a trial period of indoor faith services prior to our circuit breaker being required in March. As this has now been updated thanks to the work of the group that we have been working with, and the updated variance has been posted today, and guidelines about how indoor faith services can be started today safely, and that includes allowance for up to 50 people at indoor faith services with detailed COVID safety plans in place. And I just want to express my gratitude to Dr. Robert Dome and the wise council of the faith leaders who worked with us to develop these guidelines, and I look forward to our ongoing revision and opening up of
详细的计划，如何安全的这个阶段的宗教团体服务。那么同时呢，我们也是跟那个帐篷露营的这个协会以及呢儿童青少年发展计划这个如何讨论今年夏天。那么他今天好像有一个重要数据没宣布，也就是疫苗打了多少了。我相信应该是要接近300万。那同时他说也是好消息，我们马上也会给大家更多的详细的计划。那么同时呢，我也很高兴的给大家宣布，我们今年超过300万了。
So 3,032,811 doses of all 3 of our COVID-19 vaccines have been administered. In British Columbia, of those 156,730 are second doses. So this equates to 65.8% of adults 18 plus, or 62% of all eligible British Columbians 12 and over right now. So these are exciting times,
这个也是包括了12岁的 和
以
上的人，已经62%了，所以已经超过。他说这个也是很兴奋的数字这个也是我们整个省全省人民共同对疫苗的重视那么我们对于这个疫苗的策略，我们也是希望快速部署第一针能让所有的人能够尽快的打第一针这样的话呢，使得我们社区的传播能够急速的下降。这样的话能够使得让更多的人能够得到最基本的保护。所以这个同时呢，我们也是增加第一针和第二针之间的缩短距离因为这个所以所有的疫苗都很有效。所以这个社区的防护以及这个人体里边的疫苗的这个抗体的水平都有效的提高。这个也包括了我们长期护理院的老人们我们也是希望能够保持下去，这个发展势头能够保持下去所以我们还是要给大家确认，我们还是通过辉瑞以及莫德纳施打给以年龄为基础、以年龄为决定阶段的施打的这个决策那么同时呢，也辉瑞呢他们呢这个2针的时间呢从13周回到8周这个已经是因为我们的疫苗的供应充足因为疫苗的第二针不单单是保护了社区因为是加强针，因为这个是很重要的，是对自己来讲是一个防护了这个礼拜二他讲过第一针和第二针的区别，第二针主要是给个体更强的保护，第一针主要是为社区建立整个防线，所以这个也是那么他也是说到了加强针是很重要的，这个是绝对重要的，是使得身体里边的抗体能够长期的建立起来有效。所以我们的第二针的这个策略也是和第一针一样，也是按照年龄阶段来那么因为这些人的风险比其他年龄段的风险更大所以刚才说了从13周的间隙期变成8周了，2个月。
A high degree of immunization in people with a first dose. That's why, from our start of our program, we have taken this age-based approach for the main part of our immunization program, and that will continue with dose 2. Now that we have a steady supply coming to BC, the number of people who now have their first dose is high enough that we're able to speed up delivery of second doses for the age-based and CEV immunizations. So the standard, as I mentioned, has been a maximum of 16 weeks. We're now moving that up to 8 weeks for the age-based and for our clinically extremely vulnerable strains. So about 400,000 people over the age of 70 and clinically extremely vulnerable will start receiving their invites today.
从今天开始慢慢就接手第2针了。今天就会收到，今天开始就会收到预约通知了。说今天早上开始了因为我们这个都是在这个系统里边。这个自动的所以70岁以上，我们省有40多万人这些都是国家机密我们都能够说出来。蛮有意思的有些数据在某些国家看上去是国家机密在有些国家都是公开取得的，比如说每一个年份。每一个月份的死亡率、死亡的人数总数在西方国家数据都是公开的我不说了。这个题外话。那么他是反复强调的，就是这个第2针也是从今天开始，系统自动的早上7点钟开始向那些70岁以上老人的40万人的老人逐步发出通知，让他们来预约。
about 6 weeks. Now, with the vaccine supply
那么大家知道，从16周马上要缩短到8周了，那也可能到6周了这个主要是看疫苗的供应情况所以只要大家能够接到疫苗预约了，那马上去预约所以这个里边呢有一个误会，就是大家说我第2针是不是要注册？那这个我再说一下题外话只要是4月15号之后注册的就不要再注册了，但是4月15号之前打疫苗的，那么请你再注册一下为了是打第2针顺利进行。这个也是系统政府的没有做好，当时的系统是4月15号才推出的4月15号之前呢都是各个卫生局自己搞，只有非常卫生局是提供网上预约那么从4月15号以后就是提供给所有的人去注册，然后注册之后他才邀请你来预约。
In addition, for First Nations communities and other more remote and rural communities where we did a whole community approach, we will continue to take this approach for second doses, and we're working with the First Nations Health Authority and with the regional health authorities, and those are starting to happen as well. There are some communities where we've gone in for second doses already, and more will be coming in the coming weeks. There's no need, if you're in one of these communities, for communities to reach out. We will be coming to you and we're coordinating that with the First Nations Health Authority and the regional health authorities. I do want to say, though, that we have had, over the last number of months, some challenges with receipt of supplies of Moderna vaccine.
他说我也是想强调一下，我们上个月的月末对莫德纳的供应量有点这个小小的顾虑。那么因为这个莫德纳比辉瑞呢在运输上还更方便，所以莫德纳主要给偏远地区去打。那么请大家放心那么现在莫德纳的这个供应已经恢复正常，然后呢所以只要打第1针打莫德纳的也可以打第2针了。那么同时呢，国际上的这些疫苗组织呢都在研究混打，那么他们也是不断的更新这个疫苗的计划。
Possible. There are a number of reasons for this. People can have an adverse reaction to a dose, or they simply don't know, or that vaccine may not be available. If that is the case, we now have good evidence that it's safe to have an alternative.
那么他也是说到了，只要打第1针有强烈副作用的或者不舒服的，那么现在看来呢，可以去打混打。那么当然了，第1针是什么技术的，第2针也是打什么品牌，这个永远是优先选项。但是第1针比如说打了莫德纳的第1针，那么不舒服，那么你可以去打辉瑞，因为只要是同一个技术的那么同时呢，也有一种可能，我们也是让第2针主要是第1针和第2针的同样的产品那么
that people who received Moderna in one of the mass clinics, large community clinics, may be offered Pfizer for their dose 2.
那么同时呢，只要是你在第一针是在这种大型的施打地点，那么如果第一针打的是莫德纳，有可能第二针就会打辉瑞。那么同时呢，我们的莫德纳会给大家确认，会更多的会来。那么只要你打打信使疫苗蛋白的，那么总会。
situations we expect it not to be common, but in some situations you may be offered a Pfizer vaccine instead of a Moderna for your dose 2.
同时呢，这个可能这个情况不大会发生，但也有可能这种机会就是给你第一针是莫德纳，有可能给你第二针是辉瑞这个但是这个不是经常发生的那有可能会有这种情况发生，所以这个也是要提前知会大家同时呢，莫德纳的供应会保持正常，会有更多的。那么到6月底到7月初会更多的莫德纳来。
Is the AstraZeneca vaccine
当然了，另外一个复杂因素就是阿斯利康。那么有些第一针打阿斯利康的。
I'm asking you to
同时
hold
他们
tight
在药
for a
房
few
打
more
的
days.
那么
What we
希
have
望大
seen
家
is
稍
that
等
this
一下，
vaccine has a better response with a slightly longer
因
interval
为
between
辉瑞
doses,
那个
and
阿斯
that's
利
from
康
the
的疫苗
clinical
第一针
trials up to
打
12
完之后，
weeks
它的
had a better
抗体
response.
建立时
So
间
we're
会
looking
稍微
at what
长一
that
点
means for people
所以
here
他们
in
的第二
BC.
针可以
And
稍
we
微
are
长一
waiting
点，
on
可
the
能到
results
12周
of studies that are being
32
done,
周就是
particularly
3个
in
月
the UK, but elsewhere as well. Working through as well
所以我们
the
BC 省的人
operational
现在也在
logistical issues of how
等
to get vaccine
英国的
back
最
to
新
the
的
places
这
where
个
people
研究
received
成
it
果，
for
看
the
看
first dose.
那个
So our
那
focus
个
this
阿斯利
week
康
is on
和
the
其他疫
age-based
苗混搭
program,
所以我
and
们
I
这个礼拜开
anticipate
始
we'll
第二
have
针
more
的都是
information
按
by
照
the end
时
of
间来，
next
都是
week
给
to be
那
able
辉
to
瑞
provide advice to people who've received AstraZeneca so they can make an informed decision about receiving AstraZeneca as your second dose or receiving one of
同
the
时呢，下个礼
mRNA
拜呢，我们会
vaccines.
给大家正式的通
We
知
don't have all the
那个
information
我们
yet,
现在还
but
不知
we
道
expect to have that
你
very
第一针
soon,
如果
and
下个
we're
礼拜
working
开
out the
始
logistics
要打
with
第二针了，
pharmacies
那
as
第一
well.
针打的是阿斯利康
We
第二针
also
到底是给你
have,
打
I
阿
want
斯
to
利
assure
康，还
people
是
that
打
we will
这个
have enough
辉
of
瑞
the
或者是莫德
AstraZeneca
纳？
vaccine
那
to
么现在
provide
还不知
second
道，我们
doses
到
for
时候会
everybody
正式通
who
知你
wants
们
that.
当然了，每个人
I
都
know
是自
there
己
has
选
been an
择。
issue in Ontario where some people have been offered their second dose because of expiring stock that they had on hand, and I can assure you that's not
他
an
说
issue
在
that we have here in
安
BC
省
that
的
our
那些因为这
AstraZeneca
个
that we
阿
have
斯
now
利
that
康
we're
针
holding for
因
second
为疫苗要过期，
doses,
所以
it
都
does
给
not
打
expire
这个
until the
情
end
况，
of
我们
June. So
BC
we
省不
still
会
have
再
a
发
little
生
bit of time
所
so
以
people
我们
can make
BC
their
省的
best
阿斯利
decision.
康的过期还早，所以我们还
So
有
I
时
can't
间等待，
overemphasize
所以
the
现在在等
importance
英
right
国的
now
同
of
行
getting
以及
registered in
国
our
际上疫苗组
immunization
织的这
registration
个最新
system.
研究
It's
成果
your，
下个
ticket
礼
to
拜
getting your
有
second
些打
dose
第一针的阿斯
faster
利
as
康的
well.
第二针要
As you
到
know,
了
we，
那么我们会
vaccinated a
给
lot
大
of
家
people
正式
before
的
the
通
Get
知。
Vaccinated system was up and running, and that was about the middle of April. We weren't going to wait for the system. But for everybody who did receive their vaccine before the registration system was
所
up
以
and
这个
running,
同时也
we
说
do
到了
have
这
your
个4月
name,
15号
your
之
personal
前
health number,
没
your
有注
mailing
册的
address, and of course know exactly
我们
which
其实
lot
是有
of
你们
which
这些
dose of
数
which
据的。
vaccine you received. But what we don't have
我们
that's
知
in
道
the
你们的
registration system is
名
an
字啊、
email
号
or
码
phone number.
以
That
及
means if you're not
批号
registered in the system,
疫苗的
you can't
种
get
类
these，
但是
automated
我们没有你们的
text
联系
or
方式
emails to invite
我们没有你们的
you, to
email，
book your
我们没有
dose
你
to
们的
appointment.
这个手机号码，所以
If
还
this
是要
is the
请你们
case,
来告诉我
we
们。
are sending out letters to everybody.
所以我们
You
给
will
大
receive
家
a
都
letter
有一
from
封
me
信
letting you know that you can book your appointment for dose 2.
所以你们
Everyone
会
will
得
still
到
be
第二针
notified,
的通知，
and
只是
everyone
通
will
过
still be
信
able
件
to
来
book
了。
once you are
这个
notified.
因为我
It
们
just
是
may be a
年
bit
龄比
delayed
较
if
小
you're
的
one of，the
都是
people
4月15
who
号以后
has
注
not
册的
yet gone，
那么
on to
政
the
府
Get
都有
Registered system.
我们
So
的
you
通
do
知
have
的
that
方式
option。right
那么
now.
4月15号
If
之
you
前呢，
received
政府
your
有你们的
vaccine in
数
one of
据
our，
但是
clinics
呢没有你们的
prior
联
to
系方
April
式，
15th,
所以他说我们只能写
and
信
you
给
have
你们。
not yet gone on and registered,
这个
I
也
encourage
是
you to do
所以
that
同时呢
today,
也希望
and
你
that will
们
just
能够4月
quickly
15号之
give
前
you
打的
access
现
to
在
the
也是来
second
注
dose
册
as well.
这样的话呢第二针就会很快
So what does
得
this
到
all
通知
mean? First, we're accelerating our dose 2 for our
那么这样的
age-based
话呢，我们现在呢也是开始要庆祝了，第二针也开始开始打了，也是按照这个年龄来。
And like dose 1, we're gaining momentum on second doses as well. These, with the availability of supply, I anticipate
所以呢，我们因为疫苗的预期到货比较充足一直到夏天这个对我们来讲很重要很重要。所以这样的话，使得我们第二针能够顺利的施打，这样的话能够使得我们在9月份第4阶段能够重启第4阶段顺利实施，这样的话能够保证我们孩子们的正常开学。所以同时呢，这个也是这个。也拯救很多的生命所以只要你没有注册的，请大家来注册，又快又方便因为对大家来讲这是很重要的，对我们省的重启都很重要对我们每一个生命都很重要。这个说得很好，说得很好请你们一起加入我们几百万已经注册的人已经打疫苗的人，所以我们会给你越快越好的打疫苗。所以大家呢，我们一起共同参与来阻止病毒的传播，来保护我们的社区，让我们的社区都保护起来。还是注意的be kind, be calm and be safe 这个相当好。这个今天的伯尼医生说的相当好，我觉得他的文字功夫也不错。如果都是他写的话，不容易，一个礼拜要写2篇文章这个他一读就是读了15分钟，这应该有30千字了，所以不容易不容易如果是他自己写的话那么5个是辉瑞菲沙卫生局，2个在沿岸死亡7个他说诚挚的哀悼这个死亡7个人。那么我再说一遍，昨天到今天新增了是378，一下子多了，昨天是250，一下子多了128个。那么现在的总数呢，到了143264，我记下来应该是64那么其次呢，沿岸是98，飞沙是189，岛上真的是好，才9个。那么内陆是68，北部是14，北部显著下降了。那么这个就是疫苗的功劳特别是2个城市，一个是White Horse， 第二个是Prince Rupert 的王子市，这2个市呢就是王子港市。那么他们那个是紧急施打整个城市。那么菲沙卫生局因为人最多，所以数字还是一骑绝尘。但是呢，跟上个礼拜4给大家汇报的时候呢，上个礼拜4沿岸是80，菲沙是210，而今天的是沿岸是98，而菲沙呢是189，一个上一个下差距缩小了。
And the efforts that are going to be made in the coming weeks. So let's go to the first slide. When I announced the postponement of non-urgent scheduled surgeries in the Lower Mainland last month because of COVID-19, I made the same commitment. We made the same commitment to patients as I did in March 2020. You are not forgotten, and we will get each of you the surgery you need. This is an assertion based on evidence and the remarkable work of our surgical system, our public health care system, and the people who deliver surgeries. I want to take a minute to share the progress with you now, as I think it's important and reassuring as we look to resuming non-urgent scheduled surgeries in Metro Vancouver that have been postponed in the third wave. This achievement speaks to the significant progress made throughout on surgical renewal commitment. We are changing the way we deliver surgeries in BC by increasing operating room time and capacity.
昨天的住院是296，今天286，住院是重症监护是97，今天是98，这个没什么大区别，还多一个。
When we consider what we accomplished since June 2020, when all health authorities were fully operational after the first wave of COVID-19, we start to see the scope of the transformation, I think, that's occurring in BC surgeries. In this period, compared to previous years, we've completed more surgeries between June 26, 2020 and March 31st, 2021, 8,547 more surgeries, all during COVID protocols that made each surgery more challenging in order to keep people safer. We completed more scheduled surgeries. The focus of the surgical renewal plan, we completed 9,208 more scheduled surgeries. We performed the surgeries that patients needed most, holding true to our stated priorities. We completed 4,294 more urgent surgeries and 7,365 more surgeries for patients waiting more than 2 times the recommended wait time. In other words, not just focusing on reducing wait times at the beginning, but reducing the overall wait time, especially for those waiting longest. Through 74 initiatives across all health authorities, we added 21,966 hours of operating room time. We increased staff. Since April 1st, 2020, 1,459 healthcare providers have been hired to support surgical renewal. 391 surgical specialty nurses started their training, and 274 completed their programs. And 92 medical device reprocessing technologist students are in training, an important part of any surgical program. Next slide. Today we're also releasing, and on the government website you can find them, our monthly reports on surgical renewal. We're releasing reports 10 and 11 today, and they bring with detailed information for all of you, information up to March 31st this year. They deal with the period from February 5th to March 31st, and they're now available. On the slide, you can see one of the key milestones achieved. We have delivered surgery to 97% of the 15,154 patients who were called during the first wave of the COVID-19 pandemic and had their surgery postponed, and who still wanted a surgical treatment. So again, to those whose surgeries have been postponed in April and May, who are just postponed, you will get your surgery. You can also see that the total wait list size has decreased to 81,940. This is a 13% decrease compared to March 31st, 2020 in a pandemic. And over just 8 weeks from February 5th to March 31st, health authorities and care providers across this province performed 3,446 more surgeries and ran operating rooms an additional 6,667 hours. Also during this period, an additional 292 healthcare providers were hired. Next slide. I want to speak, when we launched surgical renewal in May 2020, we noted that our targets and timelines were highly vulnerable to external forces like a resurgence or future waves and other factors over which we would have less control. We also said we would learn and adapt as we faced each new wave, and that we would manage any reduction of services differently than we did last March. And that's exactly what we've done. As the third wave brought dramatic increases in cases and hospitalizations in Metro Vancouver and started to take a toll on our hospitals and healthcare staff, April 26, 2021 saw 9 Lower Mainland hospitals postpone non-urgent scheduled surgeries and focus on only on urgent and emergent surgeries. As of May 23, 2,153 patients waiting for non-urgent scheduled surgeries had their surgery postponed. We know, I know, that this causes tremendous anxiety. We know that every one of those surgeries is important, and we're tracking each one of them. And to these patients, I say this: you're part of our surgical renewal commitment, part of our BC Restart plan. Our surgical system is stronger than ever, and we build on the progress we've made so far. Next slide. Last year, it took us 4 weeks to fully resume surgeries. This year, it will take us 3 weeks. All 9 sites across Metro Vancouver will be fully operational by June 7th, with actions to get us to that point starting this week. These 3 weeks leading to full resumption of surgeries are essential.
第二针疫苗的今天我在不是所有的网友一开始就打开我们的节目今天的第一天也是预示着，所以伯恩Henry说也要庆祝，就是今天是第一天大规模开始开展第二针的计划的第一天，也就是说 全省40万以上的70岁以上的老人有40多万。今天早上7点以后陆续收到通知因为这些的他们都是在4月15号之前注册的，没有注册，也就是所以他说了，系统呢有他们打过针的人名、批号但是唯一没有是什么？他们的联系方式，比如说手机号码或者 email 地址。所以呢，通知他们呢，只能是有可能是语音电话，也有可能是信件。那么所以呢，只有没打过第一针的，在4月15号之前打过的同时没有注册过的，请各位观众记住了，现在赶紧谷歌一下注册。注册的目的是让第二针能够让政府快速有效的通知你去预约，不然的话就要等信件 Canada Post 最快也要30天。
Patients needing surgeries most will have their surgery first. This includes urgent surgeries, patients who have had their surgeries postponed, patients who have waited more than twice the recommended wait time, and surgeries that do not require an overnight stay in hospital or that can be done outside the operating room. This announcement of surgical resumption is, of course, welcome and reassuring news to patients and their families, and I think to all of us. But as we consider today's news and the progress reported on the monthly reports released today, we should all know this. All those involved in delivering surgeries,
可以恢复正常开刀了，的确是现在也是在慢慢赶就像去年的6月份以后开始逐渐的那么到了去年的10月份以后呢，基本上就是还清了积累下来的开刀数。那么有些开刀呢不是很严重的，不是紧急的，比如说什么膝关节换膝关节还有呢有些等等我有一个老外的邻居，他好像1个月之前他就膝关节换过手术了。那么他呢是运气好，是被延期了，但是呢没有延期的很久也是同时通知他这个是到这个比较远的地方去开刀，那么愿意还是不愿意那么当然是愿意，所以呢就开了1个礼拜行动不方便，然后就好了可能不是完全是真正的这个那个更换膝关节，只是呢这些呢手术呢都开始其实都是在慢慢紧赶慢赶的在恢复了。
All of us have worked together to make sure that everyone who needs surgery in BC and who had their surgery postponed last year gets their surgery, and that we increase and reduce wait times for surgeries in our province.
所以他也是说到了在减少这个等待的时间也是感谢大家的这个牺牲以及耐心。
We will be calling you again.
同时呢，我们也会打电话给你让你们来预约开刀的情况。他又开始说法语了，所以这个情况的确是在好转，所以他们也有信心，在这个恢复择期开刀，同时在实施第1阶段、第2阶段、第3阶段的重启。那么今天呢，另外有一个重要的更新，第1阶段是对第1阶段的更新，也就是跟各个宗教团体的领袖们的积极磋商。从今天开始，宗教服务50个人之内是允许了，是有组织的允许的这个也是一个更新。但是呢，所有的预防措施都是事先都已经今天达成共识一定要保证所有的这个卫生措施都到位，才能够允许室内50个人的宗教活动的聚集。
Hi, Dr. Henry. Is there a certain either percentage or number of doses that will be redirected to second doses? Like if we're sort of averaging 60,000 doses a day, will that supply overall, will that dosage increase, or will it be sort of a percentage siphoned off for second dosage?
Not really either of those. So what we have done is planned, and this is why it's taken some time for us to get there. What we've done is planned the appointments and the doses to each of the clinics based on the streams that we have on the go right now. So that's anybody from age 12 and up who's requiring first doses, and then we'll have second doses in those same clinics. So it really is about portioning out the
听明白了啊，反正就是说，你原则上第一针在哪一个诊所打的，基本上第二针也在哪个诊所打。这样的话呢，主要是让他们在这个药物的分发以及配置方面能够更加容易方便。
Dose 1 and now starting with dose 2 and where they are around the province. So we will be moving full steam ahead on both of those in the next few weeks.
那么接下来的几个礼拜可能还会再调整啊。所以这个现在因为是考虑到第二针了，我们这个是真的是很快。
For example, frontline workers or people living in shelters, correctional facilities, will they be contacted by public health, or do they have to register?
那么他也是说了，第一针打过的这些前线工作人员啊，包括医生、护士以及那些个人以及救火队员等等啊，那么他们是因为没注册过啊，那么你们怎么找到他们？包括那些庇护所里边打的人。
People who received it through workplaces, etc. And we will be connecting with them.
他说我们还是主动找到他们。
Most of the correctional facilities, so yes, we will be reaching out for those people.
所以是我们主动找到他们。
It doesn't harm anybody to register, and it just makes it that much simpler. But we will be reaching out again to those people who received it in very separate situations like that.
也就是庇护所的那些人啊，还有前线基础工作人啊，包括那个这个原住民啊等等。
We will be going back and doing clinics in those communities, so people can access the vaccine that way.
Okay, our next question comes from Shannon Patterson of CTV. Shannon, go ahead, please.
Oh, hi, Dr. Henry. You said that there are new guidelines for religious services, but you didn't say what they are. So can you quickly tell us what that means as of right now, what's allowed in houses of worship, and would this include things like weddings and funerals, religious services that are held in churches that aren't so much Sunday service or Saturday service, but are events like weddings and funerals.
So what we have done, and these are all posted, so it's on the PHO website, the new variants for indoor and outdoor, and the guidance documents that we've developed with the advice of faith leaders. So yes, it does involve indoor services up to 50 people, and right now, as we're in this bridging period where we're still having constraints on numbers and other activities, particularly indoors, it has provisions for things like masking, etc. It does allow for small funerals and baptisms as part of a religious service, but not at the moment for weddings. Weddings are subject to the same restrictions that we have on indoor gatherings, so still small numbers, and they certainly could be held, but the number is limited to 10 people for weddings at the moment. But those are the things that we'll be working with faith leaders to move for the next phase of this. But right now, we want to proceed slowly and carefully, and I know many people are looking forward to going back to being able to have indoor faith services with their community.
主要是个人的崇拜活动宗教活动是目前是只能是给他们50个人。
Ontario were given access to a easily accessible digital online record of their vaccination, and it's not something we have. We're just given these cards when we go to.
他说安省呢，每个人的记录都是自己可以网上看到的，而我们呢，现在 BC 省呢，只能是一张卡。这个其实我们有没有这种数字的记录呢？给个人
may become something we need to produce in the coming months when we're fully
接下来
vaccinated?
的几个月里边
It
能
won't
不
be
能做
something
到？
you'll need to produce to access services, but it is
但是
something
你
that
们
we
没
are
必要
committed to
去
everybody having
登录我们
access
的
to
数据
your
库
own
我们也
immunization
不可能
record.
给你
And
但
yes,
是你们
that
每个
is
人的
in the
记录
works.
我们都
It's
有。
very close. The
我们现在已经到了
immunization
马上到
record,
这
the
个阶
traditional
段
one that many of us still have, is a paper-based one, and
因为每个人
that's
都有
why
一张卡片
most people are receiving the hard copy one so that they have something. But from the very beginning, every single
他说
dose
从一
of
开
each
始每一
vaccine,
针
as I keep
每
saying,
都有记
has
录
gone
每一个
into
人
our
都有记
Provincial
录
Immunization Registry. And yes, this
这
whole
个是我们
system,
全省的
our
这个登记的
registration
系统里
system,
边
I
都
know
有
that's complicated because the
我知道
registry
这
and
个比较
registration are two different
比较
things.
复杂
But the registration system
大家
does
要搞
allow
清
for
楚一会儿这儿
you
注册
and
一会
your
儿是
care
那儿注册
provider to access
但是我
your
们一定
immunization
搞清楚
record.
就是
And
我
that will
们
be
这个
coming
系
very,
统
very
对
soon.
所
We're
有的
working
医
out
护
the
人
final
员都能
details of
查
how
到
you can do that.
你
Your
打
care
过疫苗
provider,
没有
public
打了
health
哪
can
一
do
个疫
that
苗
right now
哪个批次
through our immunization registry, but people will be able to access their own records electronically.
同时呢我们已经
I don't want
接
to give
近
a
了这
time
个
frame,
完
but
成
it's
工
very
作
soon.
马上就可以每个
Our
人
next
都可以
question comes
去
from Richard
自己
Zussman
获
of
得
Global. Richard,
我
go
刚才
ahead,
都收
please.
到一个短信他已经获得了个人的打第一针的所有的电子资料我刚刚收到他已经能够获得了可能已经快接近完成了
in many cases being paid overtime to do so. Why is this happening, and why aren't retired nurses or paramedics or even current nurses being used on overtime to provide these vaccines?
Well, I can't talk about the contractual obligations that people are being paid for. There's a wide variety of them. I can say that we are employing, and there are many, many nurses, paramedics, physicians, a whole spectrum of people who are working in our clinics across the province.
所以呢，相对来讲是跨区还是不行，但这个区呢有调整了，变大了，所以呢，大家可以到这个 BC CDC 的网站上去看，我具体记不清楚，应该说是沿岸和飞沙卫生局是混在一起了，可能还包括了这个低陆平原所有的地区原来那个 Whistler 没有包含进去，现在我不知道包含进去，我不一定确诊。但是呢，这个一定是很清楚，就是说3个区了，本来是4个区。
can't really say as the comparisons between one group and another, except to say this, that I think everyone, doctors and nurses and healthcare workers, pharmacists who have just been extraordinary, both those who work in the public system and community pharmacists as well. Our whole teams are doing extremely well.
原来呢，它叫 circuit break 就是垄断的这个区这个circuit 大家知道电路嘛他们用了这个词现在也是这个词，但是呢有所区别。
Done an excellent job putting people together. I know there's sometimes concern from one person or another about who gets hired, and that's part of the challenge of putting in place such a large operation. But the large majority of vaccinations have been by nurses, but obviously significant numbers have been done by other health professionals, especially, and in second place physicians, but other health professionals as well. So happy to get you more details on that, and it may be of interest to all members of the media, so we'll distribute that to everybody.
Richard, you have a follow-up question.
Thank you for that, Minister Dix. Much appreciated. A question now about self and rapid testing. As we move towards opening up more things, what is the plan for rapid testing? Could it be used for large venues like sports arenas or airports?
这个是快速测试的问题。他说能不能使得快速测试的方法用于更多的，比如说体育赛事这样的话呢，就让更多的人去
so the self-test kits have only recently been approved for use in Canada, and I know across the country the testing team, including some of our lab scientists, are involved with that. Dr. Mel Krajden, where they can be used. I've been watching in the UK where they've been doing self-testing. What we hear from our colleagues is that limited usefulness in certain situations, where I do think it is important and where we will be continuing to increase the use of rapid testing, is to support people getting back to work settings, communal living settings. So we've been using them, as you know, very effectively in places like our correctional facilities, when people come into correctional facilities, and particularly that we've done some pilot studies to support people going back to those communal living settings, where if somebody's sick, it helps us understand right away whether it's COVID that we're dealing with or not. So that's where they are most effective right now, is identifying clusters and outbreaks early, and we're using them in a variety of situations to do that. And that will continue. The BC CDC is leading a group that's been working with businesses as well to see where these might be useful in businesses as they reopen in the coming weeks as well. So there's many different settings where I can see them being of value. We are also working with the federal government, and there's a report that just came out about an hour ago. I haven't had a chance to read it yet, about use of rapid testing at airports and travel. And I know they've been looking at that, the federal task group on rapid testing. So we'll be looking at where that fits into our program as well. I think it is a good adjunct or added on piece to the core of our testing, which is the more accurate PCR testing.
Our next question comes from Lisa Yuzda of News 1130. Lisa, please go ahead.
Hi. Sorry, taking off mute. With these vaccine second doses, is this like the final frontier that we're facing to get back to life as we know it? You know, people talk about Melbourne now and they see them locking down, but their vaccination rate is a smidgen of ours. So once we get these second doses heading into the fall, is that going to be it? Maybe a booster shot somewhere down the line, or is there a possibility of another, COVID brick in the head coming our way?
I wish I knew the answer to that. I think I'll be wearing a helmet for at least another year, waiting for those bricks. There's a couple of things about it. The first dose, and this is, how we've been approaching this and looking at this, similar to some countries around the world. The first dose really is about giving everybody a very high level of protection as quickly as possible.
他说跟其他国家一样，第一针的目的主要是让更多的人打，这样的话社区能够保护起来，社区都有一个一般的免疫呢，就是一般的免疫效果是70%第一针。他说这个是好消息。那么第二针叫加强针呢，也就是再加强了10%到15%的有效率同时呢，也是对这个点点滴滴的保护起到了作用所以所以我们现在呢，也是让更多的人在处于危险状态的人打第二针开始打针。
And it is going to be important for us to keep on pushing the importance for an individual, for your own protection, to allow you to get back to doing things, but also for the community.
所以他也是说到了，第一针主要还是不单单保护你个人，还是保护社区。所以这个他始终强调了第一针的作用，所以一定要让第一针更多人先打，满足第一个人所有的人。
Immunization and even second dose
温哥华到 Delta 一直没有变这个在这个之前3个礼拜严格限制里边都没有变这个是没有变的。这个因为这个两个区是合并起来的一个区。
Protect me better, but it protects all of us better, and we're moving that up for a couple of reasons. One, because we want to get all of the protection as high as we can when there's still a lot of transmission happening in countries around the world, and we can have introduction of newer strains, so that's important. But we don't yet know if we're going to need booster doses at some point, or if some people will need them, if some people will never mount enough of a protection response on their own. What we do believe is that as we go into the fall, we have high levels of protection in the community, high levels of second dose protection, so that extra bit for all of us, that we should be able to get through this respiratory season. We may need at some point to have a booster dose. We don't know yet. This virus is mutating at a slower rate than things like influenza, but it is changing, and we've seen that with these variants where sometimes if there's a lot of transmission of the virus and more mutations, some of them will confer a survival advantage or a transmission advantage. So that's what we're seeing around the world. We're seeing it in India, we're seeing it in Brazil, in countries where there's a lot of virus circulating. So we need to get as high a level of protection as we can in BC and in Canada to protect us as this virus is still circulating globally. What might happen and what we are watching for and will need to continue to watch for is if a strain arises around the world that where it is not as amenable to the protection from vaccination. So that's something that we can't predict, but we need to be able to monitor for, and in that case, we may need to have a booster dose sooner rather than later. So all of those are possibilities that I just don't have answers for, but that we've been thinking through where they might lead and down the line and what the responses to those might be. That's why it's still so important to ensure that we have other vaccines that are in development, even if it may be some time before they're approved for use. And I'm thinking of Medicago and Novavax. It's also why we need to really continue to push on having domestic vaccine capacity in Canada to be able to develop booster doses if we need them.
Lisa, did you have a follow-up question?
I sure do, regarding masks. I know the mandate is ending on July 1st. Wondering what guidance you have to businesses that will want to keep masks in place either for their employers or employees or their customers or both, how that might work, and if
我查了查 PHO 的网站啊，它是说到了到6月15号之前，这些禁令还是有效的。所以，但我现在还在查这个地图。
Working very much the way it did last summer when we had low rates of transmission in BC. So it is all proportional. The mask is the last level of defense. It's the last thing that we have that stops us from transmitting to others and others transmitting to us.
好，我看到了一个地图，大家很清楚，只有3个区相互之间不能走啊。温哥华岛，但是这个温哥华岛呢，还包括了威斯勒那边，也就是我们温哥华北温再往北走这一部分是和温哥华岛是一个区。第二个区是我们低陆平原以及菲沙河谷，包括兰利啊这些那个米逊啊这些的叫温哥华这个那个低陆平原和菲沙河谷。第三部分就是内陆地区和北方地区 ，BC 省大部分地区是属于内陆和北部地区，只有我们低陆平原以及菲沙河谷是一个大区，同时岛上以及部分的比我们北温的再北面一点，像威斯勒这个地区，他们算一个区，就这3个区，相互之间不能走。
For the future, and that is things like covering our mouth when we cough, cleaning our hands regularly, staying away from others if we're sick. All of those things that we need to keep doing forever. We'll never stop washing our hands.
Okay, our next question comes from Rob Monroe of
所
Info
以这
News.
个
Rob,
原
please
来
go
说的
ahead.
4个区域肯定就结束了。
Thank you, Dr. Henry.
那么您说的温哥华不能到 Delta， 这个呢是之前比较严格的，就是各个城市之间，好像2月份、3月份的时候，后来我觉得他们可能伯尼 Henry 他们觉得这个不现实啊，我家在温哥华，我隔一条街就 Burnaby， 那我也不能去，也管不了，所以这样的话。 话呢，就设立了4个区，4个叫 circuit breaker。那么这个 circuit breaker 这个说法呢，就是4个区域呢，不是大家都在网上看到消息说，警察在这个各个高速公路口啊、关键的地方设立岗哨啊、检查、罚款啊。这个就执行了3个礼拜，是4个区域。那么它是以卫生局区域为主，温哥华沿岸卫生局和菲沙卫生局是合并成一个区的，所以就是这个一个区。然后呢，北方一个区，内陆一个区，岛上一个区，就是这样加起来是4个区。那么现在呢，从这个这个礼拜2开始呢，就变成3大区，就是北部和内陆是一大区，低陆平原加上我们的这个菲沙河谷地区，包括米逊啊、后帕，这个呢算是一个大区。第3个区呢是岛上加上威斯勒那个区域，就是这3个区。疫苗护照肯定不考虑这个伯尼说了，暂时 BC 省疫苗护照不考虑，因为 BC 省他说每一个人都有自己的这个记录，但是如果你要到国际上去，那么这个呢可能是联邦层面去考虑，所以这个暂时 BC 省不考虑疫苗护照，因为说到这个国际旅行，不是 BC 省能够管了，所以这个已经伯尼医生已经强调了几次，疫苗护照这个概念暂时没有。
Right now, there's still virus in BC, and in Alberta, across Canada, and globally. So we need to protect ourselves through immunization and protect our communities by all of us getting immunized.
And just, Rob, with respect to the Central Okanagan, all of the Central Okanagan Community Health Service areas are over 50% vaccinated. That's on a base of 12 and over of about 62%. But some are on the lower side, and we're going to be making some efforts. I know Interior Health will be making some efforts to increase the level of vaccination in community health service areas such as Rutland and Lake Country. I want to encourage everybody who lives in Interior Health, but particularly in the Kelowna area, this is the time to register and book and get your vaccination. I think that's important. Just with respect to a previous question, you asked about what proportion of vaccinators working at clinics are in different categories of professionals. It's different by health authorities, but I'll just give you a quick sample because I know some of you are on deadline. Vancouver Island Health, 52% of them are physician midwives and nurse practitioners. 46% are registered nurses, registered psychiatric nurses, or LPNs, and so that's what it is in Island Health. In Vancouver Coastal Health, it's 51% nurses, 29% physicians, and a variety of other professions for the rest, including many pharmacists. And in every category, lots of medical students and student nurses who have been just extraordinary, I think. In Northern Health, it's 85% nurses, 10% or 15% either physicians or community paramedics. In Interior Health, it's 85% registered nurses. In Fraser Health, where there's the most diversity of professions, 43% registered nurses or LPNs, followed by physicians at 22% and firefighters at 16%. Really, it's in Fraser Health, which is the primary place where we've used firefighters, and of course we've been mounting an exceptional immunization effort there. So that gives you a sense, and we'll be sharing this, but it gives you a sense that really everybody across the province, the largest proportion of our immunizers are nurses, and people know this because they're immunized in our nurses, but all of our professionals have been working on this, from physicians to firefighters to pharmacists who've done a great job, especially in the community program with AstraZeneca. All of them have done an exceptional job, and we're grateful to all of them.
Rob, did you have a follow-up question?
Well, just sticking to the Central Okanagan and that fairly low rate, around 50%, I think you said, Minister Dix, versus 68 or something for the province. And again, we've had all these protests here and rallies against masks and vaccines, and that Rutland's been a high transmission, low vaccine rate place for at least 3 weeks. What's going on here? Is there more needs to be done to deal with these anti-vaccine messages that are coming out from places like here?
Yeah, there always is more that we need to do to counter some of the misinformation and disinformation that is out there, particularly around vaccines, and that is something that we are working on, not just in interior health, but other places as well. I think we need to also put it in the context of the age structure of communities, and there are many communities in the central Okanagan, for example, where it is younger people more than older people. So that's one of the reasons why the rates, because people are have not been eligible for vaccination until more recently. So there's a whole bunch of different factors, but you're absolutely right. We need to address it by community and community approaches. And I know there's a lot of work going on with local leaders, municipal leaders, faith leaders, and others to try and support people getting access to
也是希望通过各个社团各个宗教能够支持我们呼吁大家去打疫苗。
It's a challenge to think about registering and then going somewhere to get their vaccine.
那么同时呢，大家可能也有点困难一会儿是注册，一会儿是预约我们都搞糊涂，有时候都会糊涂，所以一定要搞清楚，先注册，然后再预约所以这个不一样的，所以一样4月15号之前是打疫苗的，请赶紧注册。
not be bothered going into town to get to the clinic, etc. So those are all strategies that you'll be seeing some new and different things in different communities in the next little while. We've already started some of them in places like Surrey, as you know. On the island, they've started some, and I guess in the interior as well.
Just one point, when we said, and the lowest is Rutland, which is I think 50.8%, that's 12 and above, so that's 62% province-wide. Most of the Kelowna area is in the 55, 56, 57 range, so just below the provincial average, just a little bit. So we've got to make a major effort, but it's not significantly different than other places. But we're going to be continuing, I know, interior health and a lot of leaders in Kelowna are making the Central Okanagan region in general.
那么他说数字不是很大，我们当然也是尽最大的努力去动员所有的人去打这个是7个点、8个点特别是 Okanagan 地区以及北内陆，主要是内陆有些地区。
Everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today is from Tanya Fletcher, CBC. Please go ahead.
Yeah, for second doses, beyond the priority groups of clinically vulnerable and then starting with 70 plus, what about those who were bumped up earlier for dose 1 because they lived in a hot spot? Does that mean they'll be bumped up again accordingly?
这个记者问得好，他说第二针也是按照年龄来，按照70岁以上先打。那么他说热点地区能不能先打？他说我们第二针的策略和第一针的策略是差不多的，所以这个是做法是差不多的。那么有些热点社区可能也会早打。
That will happen for second doses,
所以第二针也会早打我会给他们打第二针。那么但是对这个所有的社区来讲也不是很容易的事情，因为有些热点地区的社区会很大，人口多。
And so everybody will be moved up to
但是呢，我们也会做到让所有的人能够尽快的去接种。
In early in May, then you should expect to receive your second dose invite in early July.
那么他说了，这个好。那么也就是说，如果举个例子，如果是5月初接打第一针的，那有可能是8月份6月份的初就可以打第二针了。所以这个也是好消息，也就是说你在热点地区的人，基本上1个月以后就能打第二针了。同时呢，如果你第一针打的是莫德纳，基本上第二针可能是辉瑞，但原则上给你打莫德纳。同时呢，你在第一针在哪个诊所打的，那第二针也基本上原则上在哪里打。同时呢，现在开始40多万全省70岁以上的人开始 接受第二针打的预约了。
For us being able to protect each other, so we still have virus circulating. We had another 300, almost 400
他说我们
cases
现在还
today.
看到社区里面的在病毒在传播我们今天还有370多
expanding
个。
our small, close social network, we should know the risk that each of us
我们也
has.
知道
And
还做风险存
certainly
在 每个人
if
都有
I'm
风险
somebody
存
who's
在。
immune compromised, who's going through cancer treatments, older people,
那么如
I
果有
would
些
be
人在癌
very
症治
reluctant
疗
to have somebody
那么
who's
还有特别
non-immunized
脆弱
have close
免疫
contact
体
with
没
them
有
indoors right now.
所以这
And
个
so
还是要
those
保
may
护
be
他们。
relationships or visits that you want to postpone until
所以你能
we
够
are at a
延
level
期
that
看
in the
看好
community
朋
that's
友
lower,
就是延期
or
一下
till that person has that protection from
一直到
vaccination
等他们
themselves.
有
So yes,
了保
masks are
护之
still a
后
very
所
important
以
part
口罩很
based
重
on
要
our own risk, both our risk tolerance, our risk ourselves, but the risk of those that
因
we're
为你
closest to and
口
around.
罩的话
And
呢
right
不
now
单
we
单是
should
保
be
护自
keeping
己
those
主要还
groups
是保护
small.
别人
And yes,
那么
it
同时
makes
呢
a
我
big
们希望
difference
这个
whether you're protected or not.
社
We
交
know
圈的
that this
人越少越
vaccine
好
prevents
见面的人越少
70%
越
of
好
infections on a community basis.
所以我们的目标还
And
是主
it
要是
prevents if
社
we
区有
do get sick,
70%
we're
的保
less
护率
likely to have severe illness,
这样的话
and
呢
we're less likely to
这
transmit
个
it to
社区的
others
传播
if
就
we've
会
been
少
immunized.
这样
So
会
very important. It protects
才给
me,
那些
but it
没
protects
有打
people
过疫
around
苗的
us
人
too.
保护
And
起
for
来
young people who are worrying about this is the key to us getting back our lives again.
那么
It's
对
the
年轻
key to
轻的
being
来说
able
这个
to
也
do
是
those social
70%对我们来
connections,
讲
to
是一个
having
重要
those
的
close
指标
contacts
只
that
有
we
打了
all
70%
are missing
那么
so
这样的
much.
话我们的
And
生活
that's
才能
going to
走
be
成正
important
常
as we move
所以
into
才能
step
回归
2
正常
and step
所以
3
年
in
纪
the
轻的
summer.
人希望也不要掉以轻心第二阶段重启和第三阶段的重启都是同样的重要那么他又说法语了那么我是把在数字再给大家重复一遍在过去的到今天的24小时里边新增了378总数到了143264说明一下昨天才250新增今天就378了那么延安卫生局是98例飞沙卫生局是189例内陆卫生局是68例岛上卫生局是9例北部卫生局是新增14例目前住院是286个其中88个在重症监护很遗憾有7个新增死亡本省的这个新冠疫情相关的死亡总数就到了1690例了那么他也是说明了一下基本上都是70岁以上的老人3个还是4个我没记住然后80岁以上有几个90岁以上几个那么目前为止今天也是一个里程碑的数字打了第一针的人数已经超过了300万先天已经到了303万2811例了那么总体的能够打疫苗的12岁以上的人占了62%这个也是接近了70%所以这个都是好消息都是好消息大家再坚持再坚持
ceux qui sont des personnes de troisième âge, bien entendu, mais aussi ceux qui sont les plus vulnérables. On va continuer cet effort. Donc, mais dans un cas d'une communauté comme tel Prince-Rupert, où on a fait une vaccination quasi complète de la communauté, ça va venir dans 8 semaines après et on va répéter cette expérience pour la deuxième dose. Dans d'autres cas, ça va être plus difficile, mais ça va dépendre de la première dose. Donc, tout le monde va avoir accès et on espère que tout le monde va recevoir la deuxième dose, la deuxième vaccination, je veux dire, avant le commencement du mois de septembre. Merci beaucoup. Thank you very much.
我只提到了这个礼拜一再会了。所以各位观众，那么今天的 BC 省的新闻简报我们就为大家转播到这儿。感谢您的收看，也祝您周末愉快。我们希望大家有一个愉快的、安全的周末。谢谢大家，我们星期